Good evening, everyone. Today is 28th of July 2025, Monday. It's almost 8:50 p.m. Not almost, it's sharp 8:50 p.m. In this video, I'm going to talk about my notes on Lambert Eaton Myasthenic Syndrome from Yanoff. It's not a must thing to be known by ophthalmologists. It just forms one of the differential diagnoses of the myasthenia gravis, as ocular symptoms are seen in this but not very prominent, and such cases are not handled by us. We just refer them to the medical residents, medical people, and the medicine people. So, but you should know what's the differential diagnosis for the myasthenia gravis, because myasthenia gravis is one of the differential diagnoses for various strabismic conditions and ptosis. So yeah, it's better to know this condition. Not, you should not further deeply go into its differential diagnosis like Guillain-Barré syndrome and all these things. Basics, you should know that there is ascending descending paralysis and the secondary to viral infections, and which systems are and which symptoms are commonly seen. That much is enough, but not very much required to know by an ophthalmologist. So yeah, let's start. Lambert Eaton Myasthenic Syndrome. As I have been telling you again and again, that whenever there is a short note, I don't think it will be asked for any, in any postgraduate examination, even for as a short note. I don't think so, but still, if you want to present it, it should be like the from where the name is coming, the history behind its name, and history behind the disease, then its pathophysiology, its epidemiology, then pathophysiology, then symptoms and signs, and then investigations. In pathophysiology, if there are any types, you can go for that. Then symptoms, ocular, extraocular, then the signs, and then investigations, signs, tests, investigations for the diagnosis, and differential diagnosis and treatment and prognosis, the course and outcome of the disease. So the term Lambert Eaton syndrome, it sounds like a name, right? Lambert Eaton syndrome. So these are the two scientists, neurologists, who just describe this disease. First described this disease in 1956. It is given in 1956, but in the Yanoff it is given 1953. In Google it is 1956. In Yanoff it is 1953. So this disease was named in the honor of these two neurologists who first described this condition and studied its symptoms and electrophysiological findings and its association with the small cell lung carcinoma. So who are these scientists? Dr. Edward Lambert, it's his surname, Edward H. Lambert, and Dr. Lee M. Eaton. So Lambert and Eaton, these are the names of two neurologists. And another one, I'll just mention another one is there, Edward Ruke something. So these are the scientists who are honored. When I was a child, like not exactly child, even in my MBBS days, I really hated the names of the scientists, and I really hated their contribution, because as long as the practical aspect is concerned, it's not needed to be known like who discovered it. We just want to treat the patient and heal the patient, and to know about the things related to healing, and not about the scientists who discovered it all. But it was me back then, because my focus was to pass the examination with good grades, and sometimes just pass the examination depending upon my priorities at certain stages of life. So I just hated such questions, MCQs and all the scientists, and such questions should not be asked when you are studying. But when you are teaching, it just makes the learning interesting. It's just like out of curiosity. It's something that is extra. It should not be the must thing. And now I'm interested in knowing the people who, and sometimes the history is manipulated, sometimes the work is stolen. Like I remember in my post-graduation, I was not allowed to do two research activities in my college at GMC Goa, and other people stole those ideas from me and put their name, and I was not allowed to do these researches. So history is manipulated by very cunning people, and the villains are portrayed as heroes and heroes are portrayed as villains sometimes. And the Nikola Tesla and Edison, I remember the name of the Edison, who is actually a very, who was actually a very bad person, who was a thief, and who was actually a villain, who was portrayed in our study books as a very good scientist and all. But actually the reality is not so. When I just uh, now I can see that Nikola Tesla, I don't even see his name, and he wanted us all to have the free electricity. So these people who are getting a lot of money, this government who is getting a lot of money, supplying electricity via wires, through wires and all, these people, they didn't want us to have free electricity. They want to have control over us, they want to be richer than us, they want our money. So Nikola Tesla was very ideal. He was a hero and he was truly intelligent. His work was stolen by and he was threatened by Thomas Edison. He was tried to be defamed by Thomas Edison, like I am tried to be defamed. My character is attacked and all these things. So I remember, and even these historical events like Ramayana, Mahabharata, these are all imaginary things. It never happened. There is no proof, but still such things, and this Hindu religion is completely it never existed. Their gods never existed in real life, and these things, saintly people, I'm not talking about human people, but these other things like Ram and all these things, they never existed. And people are deliberately, the true history is not taught in the Indian books and even abroad, I guess. So this is how government manipulates and brainwashes people, so that to divide the people in the name of religion, tries to invent new religions, tries to divide the people on the name of the religions. The truth should prevail. Buddha existed, Mahavira existed, there are proofs, and these are very noble religions. Even Muhammad existed and Jesus existed, there are proofs of it, but Hindu gods never existed, so Hindu religion is all bogus. And I'm just being I'm just mentioning other things, but I'm talking that when you are reading the history, you should know that everything that's given in the textbook, it's not reliable, especially as long as the history scientists, their work contribution is concerned. Until and unless you have seen them, you cannot say that it actually happened, because there are so many people who stole the things. Like there are the claims that Mark Zuckerberg stole the idea of the Facebook, and even the Bill Gates, he stole the idea of that Microsoft, that I don't know, I just didn't go much into detail about that thing. But the people, it's like, it's okay, they maintained things, and there are things that they shared the success because they maintained things. But idea stealing is something that is very and calling yourself like inventor and creator and something like that. So no, so history is manipulated, and so whenever you are reading history, you ask for the proofs. And Buddha existed, Mahavira existed, Muhammad existed, and Jesus existed, there are proofs. But among these four people and their teachings, you should choose something that's truthful and that brings equity, equality, and which is scientific and not gender biased. That you should choose, and I choose Buddha. And I like Buddha amongst all these things because there is no gender bias there, and there is equity and equality. And I always spread Buddhism. I'm always I'm all for the Buddha. It's best. It's best. I just try to criticize him, try to find things to criticize him, but I didn't find any. It's perfect. It's really good. There are differences, but there are differences because my personality is different, but there is no solid thing that I should pinpoint and deny that religion. It's the best thing, and it's up to you. So coming back to this history, so these are the names of these scientists who contributed in inventing this Lambert Eaton syndrome, and this disease name is to give honor, to remember these people. and I don't know whether they truly discovered it or stole any someone's work. I have no idea about it, but I just take that it is true, and let's move forward. So pathophysiology, we all know that it's because now we know that it's because of the antibodies formed against the presynaptic voltage-gated calcium channels, and it is divided into two types. Now pathophysiology, the types also we will include in this pathophysiology. It is divided into two types, neoplastic form and paraneoplastic form. Neoplastic, when it is associated with the paraneoplastic form, and non-neoplastic form. Paraneoplastic form means association with the cancer, malignancies, neoplasm as a paraneoplastic symptom of it. So it's lung cancer, small cell lung cancer, and other cancers, prostate, cervix, and adenocarcinoma and lymphoma. And non-neoplastic form, autoimmune diseases, other autoimmune diseases, thyroid, and then pernicious anemia, Sjogren's syndrome characterized by xerostomia, dry mouth, dry eye, keratoconjunctivitis sicca, and then what else is there? Arthritis, Sjogren's syndrome characterized by SSA and SSB antibodies, that is Sjogren's syndrome, anti-Ro antibodies. So that was about it. That was about the pathophysiology and association. And when it is associated with the cancer, that is paraneoplastic form, onset of the symptoms, it's acute and rapidly progressive, so it has got the worst prognosis than the non-neoplastic form. So pernicious anemia, vitamin B12 deficiency, because of the antibodies formed against those, absorptive receptors. You just go into detail them. As long as I remember, it's like absorption is defective in pernicious anemia. So symptoms, what are the symptoms of it? After that, before pathology comes the epidemiology that I forgot to mention. It's the age, around 60 years, that's commonly affected. Smoking is one of the risk factors because of the association with the small cell lung cancer, smoking, and bronchogenic carcinoma. Yeah, so that was in the epidemiology. And Lambert Eaton Myasthenic Syndrome, like 50% of the cases of the Lambert Eaton Myasthenic Syndrome, they have the small cell lung carcinoma. But if the patient is having small cell lung carcinoma, only 3% of the people will have this Lambert Eaton Myasthenic Syndrome. Now what are the symptoms? Symptoms, again, extraocular and ocular. Ocular, these are not very prominent. Keratoconjunctivitis sicca is a prominent symptom, eye symptom, and it is because of what? It is because hypocholinergic activity. Now lacrimal gland is there, and the secretions, the tear secretions, tear gland secretions, it is because of the parasympathetic ganglion stimulation, and the neurotransmitter involved is acetylcholine. If it is less, then the secretions are less. So when there is bilateral chronic desiccation, that is dehydration or dryness of the conjunctiva and cornea, it leads to a condition called as keratoconjunctivitis sicca. Obviously the dryness and inflammation will be there, for body sensation and redness, everything will be there. So that's the symptoms, that is the predominant symptoms. There can be diplopia, that is double vision, and ptosis can be there, but infrequently seen, and even pupil is more infrequently seen. Pupil, now cholinergic activity, what it does, it causes constriction of the pupil involved in the accommodation reflex, so these are absent. And edystonic pupil, when the postsynaptic ciliary ganglion neurons are affected, which are cholinergic. When these are affected, edystonic pupil means the light reflex is absent, not absent actually, light reflex is present but it is very poor, and accommodative reflex is brisk, because only 5 to 10% of the fibers, they go to the sphincter pupillae, and most of the fibers, they go to the ciliary muscles. But what happens in aberrant nerve generation, the opposite thing happens, and that's why the constriction of the pupil is very strong, because of the aberrant nerve generation. When there is postganglionic nerve fibers of the ciliary ganglion are affected, like in this condition. So edystonic pupil, so these pupillary abnormalities, autonomic nerve dysfunction, as far as pupil is concerned, it's infrequent, but you should know. So yeah, And these symptoms, slow cyclic velocities which normalize after exercise, means the exercise, moderate activity, voluntary contractions, they cause improvement in the symptoms. And what is the difference between Lambert Eaton Myasthenic Syndrome and myasthenia gravis? That myasthenia gravis, it presents with the ocular symptoms alone. It can be present with the ocular symptoms alone, because 90% of the cases is ocular symptoms. Most of the times it's isolated ocular symptoms. It can be there, and generalized myasthenia gravis is also there, but it occurs late. First, the patient comes with the ocular and facial complaints. But in Lambert Eaton Myasthenic Syndrome, the eye symptoms are not very prominent, and extraocular manifestations are more common. And not only the skeletal muscles, striated muscles, but smooth muscles are involved, and glandular dysfunction, that is autonomic dysfunction, is present. So what is this glandular functions? Decrease in the sweating, decrease in the keratoconjunctivitis, lacrimal secretion, decrease in the salivation, xerostomia, dry mouth, and then decreased respiratory secretions, and respiratory muscle weakness can be there, but it is not very mentioned so prominently in this condition. Proximal muscle weaknesses and leg pain, leg fatigue is there, and constipation, urinary retention. These are the signs of the hypocholinergic activity. So orthostatic hypotension, hypohidrosis, decreased sweating. Now, what are the tests? Differentiating tests from the myasthenia gravis. All the myasthenic tests, myasthenia gravis test will be absent here, and there is paradoxical elevation in the up case, prolonged up case. What happens? The ptosis worsens in myasthenia gravis because of the fatigue, but here in this case the ptosis improves. There is paradoxical improvement in the ptosis because this calcium is sustained inside the muscles because of the contraction again and again, even the repetitive nerve firing. It causes that acetylcholine release more and more. It accumulates in the synapses, so it improves the symptoms. Deep tendon reflexes are hypoactive or absent, and improvement in these reflexes seen with the moderate activity, mild to moderate activity, and voluntary muscle contraction. Electrophysiological studies will confirm the diagnosis, and low rate stimulation 2 to 3 hertz nerve stimulation, that will cause what? Decrease in the response, and high rate nerve stimulation, high intensity nerve stimulation 20 to 50 hertz, it will cause 2 to 10 fold increase in the response. Single fiber electromyographic study results will be similar to that with the myasthenia gravis. So this tensilon test is negative. No acetylcholine receptor antibodies found in the Lambert Eaton Myasthenic gravis, unlike myasthenia gravis only. So if the patient having Lambert Eaton Myasthenic Syndrome, and if you are suspecting, then we will go for this test, serum test, and antibodies against the presynaptic voltage gated calcium channels, VGCC antibodies. This is present in 85 to 90% of the cases. When the test is negative, it doesn't mean that the patient doesn't have the disease. In 10% of the cases, patient may have the Lambert Eaton Myasthenic Syndrome, but mostly it is positive. This antibody test is positive. But if the patient is having small cell lung carcinoma and Lambert Eaton Myasthenic Syndrome, then 100% of the cases will have these antibodies. The blood test, serum test, will be positive for VGCC, that is voltage gated calcium channel, presynaptic voltage gated calcium channel antibodies. These will be present in 100% of the cases if there is a small cell carcinoma with these myasthenic syndromes. Now, differential diagnosis: myasthenia gravis, Guillain-Barré syndrome, polyradiculopathies, Sjogren's syndrome, lumbosacral plexopathies. I'm not going to go much into detail about these things because we don't handle such cases, and we don't handle these cases. So it's okay if you don't know, and I don't want to waste my time because I have so many other hobbies also, and I'm not interested in managing the case as an ophthalmologist. So medical reference. Then What other investigations we can do? Thyroid function test and blood count, vitamin B12 for pernicious anemia, blood count for lymphoma, then erythrocyte sedimentation rate, autoimmune conditions. It can be elevated, and antibodies, SSA, SSB antibodies, Sjogren's syndrome antibodies, anti-Ro, anti-La antibodies, because association with this Lambert Eaton Myasthenic syndrome. Yeah. Now, what is the treatment? Treatment is 3,4-diaminopyridine, which blocks the potassium channels. When the potassium channel is blocked, the presynaptic depolarization means the positivity increases of the presynaptic nerve ending, and that leads to increasing the release of the acetylcholine. So 3,4-diaminopyridine, which blocks the potassium channel, it enhances the release of the acetylcholine. And other immunosuppressants, steroids, azathioprine, mycophenolate mofetil, cyclosporine, rituximab, these antibodies. These immunosuppressants can also be effective, but it takes a lot of time, weeks to months, for the action to be seen. And also we have to monitor the blood cell count and liver function test and renal function test if you are using these things. Then other conditions, plasmapheresis, intravenous immunoglobulins can be used in severe condition, life-threatening condition. If we use the magnesium, it can worsen the condition. So magnesium and other neurotransmitters or other substances or drugs which hamper the acetylcholine release should not be used. The cholinergic drugs like neostigmine, pyridostigmine can be used. Can be effective in this case. Yeah. Now, course and outcome or the prognosis of this disease. Presence of antibodies of malignancy, presence and absence of the malignancy determines the prognosis. Obviously, the paraneoplastic form means association with the malignancy, that is like small cell lung carcinoma, prostate, cervix, adenocarcinoma, then what else is there? Yeah, lymphoma. If it is associated with the cancer as a paraneoplastic form of the disease, then symptoms are acute and rapidly progressive, so the prognosis is going to be worse than the non-neoplastic form, which is associated with various autoimmune diseases like thyroid, Sjogren's, pernicious anemia, systemic lupus erythematosus, and so many others. So yeah, and go for the screening for the lung cancer. One of the management part is like treat the malignancy if it is there, and quit the smoking and moderate activity. Moderate active lifestyle is beneficial because the voluntary contraction, it improves the symptoms. And but don't go for vigorous exercises, that should be avoided. Magnesium should be avoided. Screening for the cancers, that forms one of the managements, one of the parts for the management. And yes, and these symptoms, they precede the diagnosis of the malignancy, that this weakness to the muscles, it precedes malignancy diagnosis like small cell lung carcinoma even 7 years before the diagnosis of this cancer or symptoms of this cancer. So screening of the lung cancer is very essential. If you diagnose this condition, regular screening for this cancer, and even if the cancer is treated and cured, look for regular screening for the recurrence of the cancer. So that was all about the Lambert Eaton syndrome, with some extra opinions of me on the history, on some religion part, and how the history is manipulated. So I hope you like this video, and again and again I'm telling you, it's good to know this, but it's not a must thing to know about this much in detail about this disease. So I just wanted to feel fully satisfied and complete this chapter on neuromuscular diseases from the Yanoff. So that's why I just covered these 3 things: myasthenia gravis, botulism, and Lambert Eaton Myasthenic syndrome, along with certain other differential diagnoses, but we should not go so much in detail into it. So it's fine. I hope you like this video and enjoy this video. Bye. Good night.